This is the AskDrV webinar and everything you want to know about COVID-19 and the COVID vaccine. For those of you that are new to this webinar, my name is Dr. Valda Crowder, also known as Dr. V. I'm an emergency medicine physician. I've been practicing for 30 years. I've treated patients across 4 pandemics, 2 Category 5 hurricanes, and a mass shooting. So I put this together back in February, and we've adjusted and updated this weekly as information has been changing very, very rapidly. All of the source documentation you can find on my website, which is AskDrV.us. We taped this presentation and everything is dated. So you see there, today's is January 5th. You can also follow me on Twitter, AskDR_V. So let's get started. The structure of the webinar will be a 10 to 20 minute slide presentation followed by Q&A. And we normally end by 9 o'clock. During the presentation, everyone is in listen mode. While the presentation is going on, you can actually type in questions under the Q&A or also under the chat icon. I will actually look at both and begin to answer questions. Some people have actually sent me questions ahead of time. If you send me questions at the end of this presentation, then I actually look up information I included as slides in the actual webinar. So if there's things that you want to know more about, please make sure to email me afterwards or put it in the chat, and I will add that information to the webinar so that this also includes information that you really want to hear about. All right, let's get started. The intention is to keep webinar participants informed with COVID-19 science that will help you and your family stay healthy during this pandemic. The outcome is that you'll leave the webinar motivated to create or improve an action plan for yourself and your family. And you may be motivated to create or improve an action plan for your broader community. You may be responsible for a homeowners association, a union, a school, a church, or another broader community, workplace also. So let's take a look at the stats. Total cases globally has been 86.7 million with 1.8 million deaths globally. United States, we are 4 to 5% of the world population. However, we represent about 25% of the deaths and 25% of the cases. So even though we're only about 5% of the world population, we dramatically represent a lot of cases and a lot of deaths. 21 million cases and about 364,000 deaths as of today. Just to actually look at how we compare with other countries, this is coronavirus cases per million residents. So this graph actually accounts for the fact that we have a higher population, a higher number of citizens in our country. So this actually accounts for that and actually looks at it on a per capita basis. Now, as you know, we're also keeping stats on the vaccine. There's been 15 million doses of the vaccine delivered to various states, and 4.5 million of those vaccines have been delivered, actually administered and put in people's arms. All right, so there's been a lot of talk about, if things keep getting worse, will our healthcare system collapse? And I want to kind of go over, well, what exactly does that mean, a healthcare system collapsing? So I want to actually just give you a couple pointers of what it means. So one is, when a healthcare system collapses, you'll see a lot of different things occur. One, you'll see unusual spaces used for hospital beds. So in LA, they're putting hospital beds in the chapel and in the gift shop. You will have facilities that will run out of PPE, specifically the masks, the gowns, the gloves. They will also maybe even run out of oxygen. More importantly, what happens is they run out of staff, right? Specifically nurses and physicians to actually help man their ICU or their regular medical floor beds or their monitored beds. You will also see ambulance diversions and a refusal to transport. So EMS may come and say, and remember, EMS is, paramedics, and they may come and say, you're not sick enough to go to the emergency department. Or they may say, you look so sick that we think that you're too close to death to actually be cared for, right? So a lot of really difficult decisions begin to be made out in the field. So if you look at what's going on right now in Los Angeles, you have had ambulances that have been ordered to conserve oxygen. Patients with COVID-19 use high flow oxygen. You can also see when a healthcare system is collapsing, a lot of holes in the emergency department. So patients that can't get upstairs to a room because there are no rooms. You can also see EMS ambulances where the paramedics may begin pronouncing people in the field as opposed to bringing them into the emergency department if they're in active resuscitation. And lastly, we already have had hospital ethics boards that have been set up at all of the hospitals, and they will set the standard of medical care, and they may change the standard of medical care and allow for the withdrawing of care if we get to the point where where the system is near collapsing or collapsing. So when this occurs, this is actually when the system begins making decisions that normally families and individuals are making. So it's a very, we do get into the part of rationing, literally rationing healthcare when you have a collapsing or overwhelmed healthcare system. This is basically, the New Yorker did something on COVID-19 for the entire December 28th, 2020 version of it. And it goes over in depth things that we could do better to improve not only our response, but also vaccinations. All right, now, a lot of people ask me why I'm not flying. I tell people all the time. So I want to go through this because I think this is really, really important, especially with everything that we're seeing now with all these variants and mutations in COVID-19 coming out. Southwest Airlines announced that they were no longer going to be blocking the middle seat as of November 30th. So they now are flying with a full plane. We actually looked and we looked at what are all the planes doing. So, you know, if the first column is, are masks available? If you show up without a mask, are they able to give you masks? Most of them are, except for Frontier, Spirit, and Sun Country. Are masks required? All of them require the mask. Cleaning before every flight. Allegiant, Spirit, and Sun Country are not cleaning the planes before every flight. I want to repeat that. Allegiant, Spirit, and Sun Country are not. Middle seats being blocked. The only airline that is consistently blocking the middle seat and has agreed to do so has been Delta Airlines, and they have said for now that they will do that until March. So that is really, really, really significant. Now, the other thing is that you have people like this couple that was actually flying. Both of them were COVID positive. They lied on the screening sheet, and both of them actually got on a plane and knew they were COVID positive. When they landed in Hawaii, they were arrested, but they flew from San Francisco to Hawaii being COVID positive. If you have a full plane, there's no way that you do not have COVID positive patients on there, whether or not they know it or not. There's a lot of asymptomatic spread of this disease. So I said, these people happen to know that they were COVID positive. However, you will also have some people that didn't know they're COVID positive. This is another patient on United Airlines, a passenger who died midair. They had to make an emergency landing. He also lied on the screening test, on the screening questions that they asked. He coded midair. The healthcare worker on the flight that actually performed CPR also became COVID positive. And one of the passengers helped when he passed out. He became COVID positive. And now you have passengers that are seeking legal action against United Airlines. So really, at this point, we really should be testing everyone before they're flying, or people should have to bring a negative COVID test in the past 3 to 5 days to fly. Now, why? Because COVID-19 is highly, highly contagious. You must respect COVID-19. The minimum time of exposure it takes to infect other people is 45 seconds. So if you think about a long flight, most people are going to take their mask off, to drink a cup of water, to eat something. The percent penetration, which is how many people actually get COVID-19 out of 100 that are exposed to it. So if 100 people are exposed, about 80 of them actually get COVID-19. As we said, it's a droplet and an airborne disease. That's how come the initial recommendation was to stay 3 feet from people, and then it was actually increased to 6 feet, because we realized that it transmits both as droplets and as airborne. So this is what it would look like if this gentleman had COVID, with him talking, singing, sneezing, coughing, any of those things. So there would be some droplets in red that would actually drop very, very close to him within 3 feet. Then there would be smaller airborne particles that would actually transmit a lot further. You can see how if he had on a mask and you had on a mask, it would make a very big difference. All right, so let's talk about, how do you know if you actually have COVID-19? How do you actually, how's the diagnosis made? So there's 3 ways: PCR test, an antigen test, and CAT scan findings. So the PCR test is a gold standard. That is genetic material of the virus that's actually done by nasopharyngeal swab. It's most accurate 8 days after exposure, and it can be inaccurate if it's administered too soon or administered too late. Now, you know if you had a PCR test because it's very, very uncomfortable. Normally, they jab the swab very, very high up your nose. It's pretty uncomfortable. Now, the test that is not as uncomfortable is an antigen test. That is what we call the rapid test. That's where they just take a swab of your mouth, may take it of your nose. But the problem with that test is that it'll tell you that you do not have COVID when you do about 30% of the time. So if it's positive, it's true. If it's negative, you probably need another test. Now, the other way you can actually tell is if you have a CAT scan. And we have people who are negative, and we perform a CAT scan. And these yellow areas here, it's very, very slight, but the sort of white puffiness that you're seeing on the CAT scan on both sides, that is what we call ground glass opacifications, and that is significant for COVID-19, and you can diagnose COVID-19 by CAT scan. Now, the most accurate diagnosis of COVID-19 is actually the dogs. So COVID-19 has an odor, and dogs can be trained to actually sense it. So this would be a very easy way to make airport travel safer, by actually using dogs that are trained to sniff out COVID-19. This is actually found to be more sensitive actually than the testing. Lastly, they recently had emergency FDA approval for this home test. So this is a home collection kit. You still have to send it in. So it has a prepaid express return shipping label, and you send it on in. This is on Amazon, that you can pick it up on Amazon. It's called Dexterity, or Doctorsterity. And this is a home saliva COVID test that uses the PCR, or the more accurate PCR technology. All right, so let's talk a little bit about the symptoms. There's 6 clusters. Clusters 1, 2, and 3 are ones that are more likely to actually, you're able to take care of yourself at home. Cluster 1 is flu-like with no fever. Cluster 2 is flu-like with a fever. And cluster 3 is when you have more vomiting, abdominal pain, diarrhea. Now, with all of these clusters, the most common early symptom that you get is loss of smell, loss of taste, or loss of appetite. Cluster 4, 5, and 6 are more likely to be hospitalized, more likely to actually need the ICU, more likely to actually get on a ventilator, and are also more likely to be fatal. Cluster 4 is when you have fatigue. Cluster 5 is when you have confusion. Cluster 6 is when you have all of the symptoms together, the viral-like symptoms, the respiratory symptoms, and also all of the abdominal symptoms. So that is how COVID is sort of distinguished as far as the symptom cluster. Now, I got a lot of questions about how often certain symptoms occur, and I apologize for the poor quality of this slide. But people were asking, well, how often do the symptoms, what percentage of people get what symptoms? So a fever occurs in 78% of people, which means that you have 22% of people that never have a fever. A cough occurs in 57% of the people, which means you have about half the people that never have a cough. Fatigue occurs in 30%, loss of smell in 25%. Difficulty breathing only occurs in 23% of the people. So that's what I'm saying. Some people really do not have difficulty breathing. Shivering in 18%, body aches in 7%, body aches in 17%, wheezing 17%, headaches 13%. Some people actually get a sore throat. Joint pain, confusion, all around 11%, dizziness, and diarrhea in about 10%. So this kind of shows you why this is a disease that is not just a respiratory disease. It's a little bit of everything. All right, so we talked a lot about COVID versus the flu. In some of the worst years that we had in the flu infected about 45 million people and led to about 80 or 90,000 deaths in a year. COVID has infected 16 million people and has actually led to 3 times as many deaths, 308, I think we're now up to 360 deaths in 9 months. So we have not made it to a year. We will make it to a year probably sometime, I think in February or so. By that time, we will be very close to 500,000 deaths compared to the flu, which in its worst year gave us about 80 or 90,000 deaths. The other reason why COVID-19 is distinct, it is highly, highly contagious. When we in the hospital deal with the flu, we do not have to shut down elective procedures. We do not have to shut down the other parts of the hospital. COVID-19, we do. Right now, in the hospitals, 100% of the ICU beds are COVID-19 beds. In my 30-year career, I have never seen 100% of the beds be related to the flu. Now, the other thing COVID-19 is distinct is COVID-19 is a multi-system disease. I tell people it's not a respiratory disease. It's a multi-system disease. It causes renal failure. It causes myositis, which is inflammation of the heart. That's why the basketball player from the Gators suddenly fell out while he was playing a game. It also causes strokes and it causes blood clots in your limbs. Also, there are some people who, after COVID-19, have required a double lung transplant. I don't know any patient that has ever required a double lung transplant after the flu. In addition, some places in patients in the ICU require ECMO. And we'll talk a little bit later about what ECMO is. That is not something that we use in the flu. All right, so what happens if you just found out you or somebody else is COVID-19 positive? One, you want to quarantine immediately, preferably for 21 days. You want to make sure before you find out you're COVID positive, have some things in your home. Have a pulse ox. What you're seeing to the right-hand side there, that is a pulse ox. If you do not have a pulse ox in your home, when you get off of this webinar, order it. It's only about $20 to $30. You can get it on Amazon Prime. Why is this so important? This measures the level of oxygenation in your blood. Normally, if you have a pneumonia, you'll know you're short of breath because you have a pneumonia. With COVID-19, you have a pneumonia and you don't feel short of breath. And the levels of oxygen in your blood get dangerously low quickly, and you don't know it. And that's why you're seeing people pass out, fall out, etc. So this, where it says SpO2 is your oxygenation level or your hemoglobin saturation. Here it's 97. It should be 95 or above, assuming you're a healthy person and you are not a smoker. The second number is just your pulse rate, which is important. It should be anywhere between 60 and 100, 105, 110 or so, depending on if you have a fever. But the most important number is your hemoglobin saturation. Now, you also want to take zinc and vitamin D3, preferably again before you catch COVID-19. Zinc deficiencies and vitamin D3 deficiencies are all associated with not doing well with COVID-19. If you quarantine, you want to have a bathroom that can only be used by yourself. You want to actually have a cell phone in the room with you. If you get into trouble, you're going to call 911, not a family member. Because if you call a family member, then they're going to get COVID-19. You want people to leave food at a closed door. You want to open windows in your home. If you live with others, you want to use a HEPA filter. All right, so let's talk about what type of what sort of treatment do you get when you actually get COVID-19? What sort of things should you expect? So we talked about the pulse ox. They'll put you on a pulse ox. They'll give you oxygen if your oxygen level is much less than 95%. We talked about zinc and vitamin D, which are very, very important. Sometimes the hospital will not give you that. So you want to make sure that you're doing that at home. Famotidine is very important. It is Pepcid AC. You can also buy this and you can have this at home. Now, people say, well, my stomach doesn't hurt. This isn't for your stomach. This is to block histamine release. With COVID, you get an inflammatory response. Blocking that inflammation actually has you do better with COVID-19. So famotidine does that and is associated with lower hospitalization deaths and lower likelihood of being put on a ventilator. Dexamethasone, that is a steroid that also blocks inflammation. That is something you can only get in the hospital, but that has also lowered the death rate. Remdesivir is an antiviral. A lot of hospitals are not using it anymore. It really has questionable benefit. I wouldn't be concerned if I was at a hospital and they did not give my family member remdesivir. I would not be concerned about that. Regeneron, this is very important. This is the antibody cocktail. If you are someone that has a risk factor for COVID, you have asthma, let's say you're a little overweight, let's say you have high blood pressure, let's say you have diabetes, any of these things. Another big risk factor for COVID-19 now is Down syndrome. You want to make sure that you get the antibody cocktail, and you have to get this within 10 days of becoming positive. Eli Lilly's antibody cocktail was approved on November 10th. So you have to find a place that has an infusion center. Not every hospital has an infusion center, and not every hospital actually will give you the antibody cocktail. You've got to make sure to ask. This is basically one of the screening tools for whether or not you qualify. And I just want to show you that basically, if you're 12, if you look here, if you're 12 to 64 years old and you have renal disease, diabetes, immunosuppressive disease, a BMI is body mass index greater than 35. So that's basically maybe a woman that's 5'7" and 200 pounds. You are eligible. If you're over 65, you are also eligible just based upon age. So any of these criteria, you actually want to get the antibody cocktail immediately. Let's see here. Let's see if we can get this thing going back to where it was. Sorry about that. There we go. All right. So we're going to talk now. The other thing that you see in addition to intubation is what they call ECMO. And I'm going to go over what that is. Hold on just a second. Okay. E is extra, meaning outside. C is corporal, meaning outside the body. M is membrane. And O is oxygenation. So basically what this machine does, show you a picture of it here. They open up your chest and they actually put these tubes in the major arteries that come into your heart and out of your heart. And they take all of the blood out of your body, oxygenate it in this machine, and then put it back into your body. Some people call it a mechanical heart and lung machine. It is normally used for cardiac bypass surgery, right? However, or complicated transplant surgeries. However, we are seeing ECMO machines being used for COVID-19 patients. The issue is this is another important resource at a hospital. A major hospital may only have 6 or 7 ECMO machines. So again, it's one of those things of, who gets that? And they will usually reserve it for someone who is younger. They're just showing you can get COVID-19 twice. This young woman, 102 years old, lived through the 1918 flu and also beat coronavirus twice. All right, so let's talk about the vaccines here. We talked about it replicating and how it replicates in your body. So the RNA virus is inside this fatty coating, and it is the light orange. The dark orange is the fatty coating, which also has spike proteins on the outside. The spike proteins connect with a receptor. And once it connects with that receptor, that actually brings the virus into your body. From there, there's messenger RNA, which tells your body to make copies of this virus. And it makes multiple copies. And then it reassembles, and it actually goes and infects the next cell. And it keeps doing that and keeps doing that and keeps doing that. So messenger RNA, there's lots of different types of RNA, but messenger RNA actually is a thing that tells your body copy and synthesize and make this protein over and over and over again. So how do these new vaccines work? So the Moderna and Pfizer vaccine are messenger RNA vaccines. So basically, there's a messenger RNA in the vaccine that's coded for the spike protein. When you get vaccinated, it tells your body, make the spike protein for COVID-19. Your body makes the protein, and then your body recognizes it as foreign and develops antibodies and kills it. Now, when you see COVID-19 and you see that spike protein in the community, you actually already know how to fight it, and your body will naturally fight it. The Johnson & Johnson vaccine, which has not yet been approved, is a different approach. It's an approach called a viral vector approach. They combine adenovirus, which is a common cold, the virus for the common cold, with some genetic material from the COVID-19, and it renders that combination harmless. And it teaches your body to generate and attack the COVID-19 spike protein so the virus cannot actually make you sick. So that's how that vaccine works. Now, there's a lot of different things to look at, dosage, effectiveness, etc. So I just put it here. Both the Pfizer and Moderna vaccine are 2 doses. They're both 90% plus effective. They're both associated with soreness and fatigue and muscle aches, possibly. The distribution of Pfizer vaccine has to be in cold storage, like liquid nitrogen. Moderna can just be put in a freezer. And we are waiting for some of the documented literature. It's been peer reviewed by the FDA, but some of the actual documented literature to come out. All right, FDA has warned to keep the, they've been looking at, can we change the dosage? FDA has warned no tinkering with the amount of COVID-19 dosing. It's really important that this prevents people, these vaccines prevent you from getting sick. We're not clear yet if you are still able to transmit the virus. So for that reason, people will still have to wear a mask. Kizzmekia Corbett, people have asked me about the African-American woman who was associated with as one of the key scientists behind the Moderna vaccine. Here she is. She actually works at NIH with Dr. Fauci, and we are very proud of her and her work. Vaccines to come. Johnson & Johnson, you will probably see that end phase 3 around the end of this month, and I wouldn't be surprised if that does not get emergency approval in February. AstraZeneca similarly, and then you also have Novavax, which just started phase 3. So if that vaccine works, you may see approval for that vaccine in the late winter. All right, so now there's been a lot of talk about these mutant COVID strain, the mutant COVID strain from the UK. So one of the things about it is more infectious. It's called variant B.1.1.7. And basically, the spike protein binds very, very tightly and more efficiently to the receptor. So it leads to virus getting into the body more quickly. So people who have this strain seem to be able to give it to others, give it to more people. And also what happens is when people get sick, they have a higher load of virus. Now, they've been talking about one variant and one mutation, but there's actually three. So I want to actually go over all three of them. I've just called them variant 1, 2, and 3 because a lot of them are so new, they haven't even gotten names. So the variant 1, which we just talked about, that is the one that is B117. That was found in the UK. It's found to be more contagious. It's associated with very high viral loads in patients. They have found that there's minor changes to the spike protein, which is why they think that the vaccine will still possibly be effective, but they're not sure, and they're studying the impact on the vaccine. Variant 2 was found in South Africa. This is also more contagious and associated with high viral loads. This has actually, we made a mistake there. This has major changes to the spike protein, so I need to change that. This one has, so the one in South Africa has major changes to the spike protein. So that one's a little bit more concerning for that reason. Variant 3 was found in Nigeria over the Christmas holiday. And they are actually doing this genetic sequencing on that strain now. Again, this is where we talked about UK scientists worry that the vaccines may not protect against the South African strain because the South African strain has a lot of mutations. This just goes back to the fact that we still need to wear a mask. I think we will see where, you know, there's still, World Health Organization is still suggesting that travelers should quarantine. I think primarily because some of these variants, I believe that people really should not be traveling unless it is something that you cannot avoid. You know, a death in some of the family, somebody that you've got to, you know, close down their house, or it's got to be something really, really, really significant. Otherwise, you should just stay at home. There's a couple stories here about people who got vaccinated and then tested positive for COVID. Again, if you get vaccinated, you will not develop full immunity after the first vaccine. So you can still get COVID positive. Additionally, when you get the second vaccine, it's really almost 2 weeks before it becomes fully effective. As we've discussed, this will not be the last pandemic. So we really need to actually get our pandemic playbook together so that as a country, we can actually respond effectively because it makes a very big difference as far as your worldwide competitiveness if you're able to actually respond to pandemics and handle them effectively.